Hi, I am Dr. LaQuita Johnson. I inspire patients to be proactive in their health. I empower pharmacists to be frontline healthcare practitioners, and I impact the American healthcare system. So a little bit about me is, of course, you see I have a PharmD and MPH, so I'm very interested in MPH and public health as well. And it is National Public Health Week, so I'm very, very excited. And I do want to, hey guys, welcome. I'm sorry I probably can't see your comments right now, so just welcome. You can introduce yourself in the comments if you want. I'm just introducing myself. And I do want to talk about tonight's giveaways. There'll be 3 giveaways given out this week, but tonight I will be giving away the LinkedIn profile review. So if you like your LinkedIn review, simply like the page. If you already have, that's totally fine. Then I want you to share this live because hey, I need to go viral. Stop playing. But share this live, as well as comment comment with a hashtag PharmD moving forward. So that's PharmD, PharmD. I had to think about that. Moving forward. That's FORWARD. So just comment below and we'll surely get started. So healthcare. Oh yeah, and well, first of all, I will say this. If you're joining again, just comment in the I see your comments coming now, so I see it. Okay. Hi Keisha. Hey hon, how you doing? So, I do have a question for you guys. When you think of pharmacists, when you think of a pharmacist, what is the first thing that comes to mind? Do you think about dispensing medication, somebody putting pills in a bottle, somebody who just, I don't know, tell me what you think. I want to know what your thoughts are. When you think of pharmacists, like, what do you really think? Just interested to know. So, what do you think when you hear you hear about a pharmacist? What comes to mind? Because I think it'll be really great. So I know for most people though, it would be you put it's like someone with a white coat and a pharmacy who gives you your medications, or sometimes people only think of community or hospital. However, there are pharmacists do way more than that. So I do want to explore. Let's talk about some of the things and go from a retrospective perspective of pharmacy. So in healthcare. So over the years, and I must say, if I'm looking down, it's simply because I'm reading my notes. So excuse me if I look down, I'm reading my notes. I made just to make sure I stay on course because I can be a bit long-winded. So make sure I stay on course. So healthcare over the years has changed drastically, from healthcare costs increasing, as well as the healthcare quality and access to healthcare has decreased. And there always have been 3 common trends, which have been health plans, healthcare providers, and patients. In terms of health plans, they have aimed to provide cost-effective benefits through partnerships. However, that's still a work in progress. And then you have providers, which aim to provide high quality and value services through collaborative agreements and interdisciplinary team approaches, as well as patients who have been, which I must commend on, many patients have involved themselves in being healthcare consumers, and by seeking that knowledge, I know as a pharmacist, when I was in community practice, patients would come up and ask exactly how much this medication costs. So you guys are being very proactive in choosing the health plans and just being proactive in your health and making sure you have the best thing forward. Hi guys, welcome again. Just start introduce. You haven't missed too much, so just started. So again, welcome. So then you have historically, pharmacists' role have been centered around dispensing. I can't talk right now. Pharmacists' roles have been centered around dispensing medications in accordance to the prescription and providing a final check at the end where to make sure your medication is accurate and safe, as well as efficient before we deliver to our patients. Although we have had so much training in preventive care and patient education, as well as health and wellness, we typically only have our knowledge, use our services mainly to review medication regimens and to provide drug and to make, I said, to provide and to prevent our services of preventing drug interactions and inappropriate dosing. So that's a couple of things. However, well, today I would say I want to talk about more about how we kind of have left that. I won't say we left it, but we have expanded our services, expanded our roles to more direct care, a direct patient care through preventive care services, as well as medication therapy management, also known as MTM. So in addition to community pharmacies and hospitals, we have also in those settings, we have also been in ambulatory care settings, outpatient settings, inpatient settings, as well as medication reconciliation. When I know some of you who have been admitted to hospitals, some hospital settings, our pharmacists will come and give you bedside counseling. And in addition to we are in pharmaceutical industries, we in the pharmacy benefit manager sector, our PBM, as well as the government. So we are truly involving. But so again, I just want to say, for those of you who have joined, welcome, and to receive tonight's giveaway, which is the LinkedIn profile review, simply share this live, use the hashtag PharmD moving forward, and you will receive it. And I actually will, even if you are watching the replay, you can still participate. I will announce the winners tomorrow by 1 p.m. Eastern time, so you have plenty of time even if you're watching the replay. So, preventive services. This is one of the key things that pharmacists we constantly do, and which we do cholesterol screenings, blood pressure screenings, diabetes screenings, as well as vaccinations. And vaccinations started in 1995. In 1995, there were only 9 states that allowed pharmacists to immunize, but today all 50 states, including Puerto Rico and District of Columbia, our pharmacists are authorized to give vaccinations, and in which we also conduct, again, multiple screenings, and I say more chronic disease prevention screenings, like blood pressure monitoring, blood glucose, our blood sugar, as well as cholesterol screenings, and the list really goes on. We even go to depression screening as well. To be more personable with you guys, I remember a patient came in, and actually he was walking to the pharmacy and he fainted, and I had to go check his blood pressure really quick because basically he took his medication right before walking to the store and didn't even eat anything, so he fainted. So I had to check his blood pressure and monitor him throughout to ensure that it was just dead and not any underlying medical condition as well. In addition to blood sugar, I will say that I remember we had a blood sugar screening, our blood glucose screening for diabetes awareness month, and a patient came in and their fasting blood sugar was like 300. So again, I had to recommend the patient go to see a medical doctor, because that's kind of like a very high range for blood sugar. So that's some of the things that we do. Pharmacists also, we have on our main service we focus on is medication therapy management. And medication therapy management is where pharmacists improve medication adherence and clinical outcomes while reducing costs. Now, medication therapy management was founded upon in 2005. But it wasn't until 2008 that the actual definition was provided. And I'm gonna read you the definition. And it says, MTM is a distinctive service or group of services provided by healthcare providers, including pharmacists, to ensure the best therapeutic outcomes for patients. So medication therapy management is one of the key services that pharmacists provide, which set us apart from multiple people, and that set us apart from different healthcare professionals. Because being honest, most healthcare professionals, they only take one course, maybe 6 months in pharmacology or medications, where pharmacists spend the entire 4 years to learning medication. So we are definitely your medication experts. So if anything, you need to come to us about medication. And I wouldn't say limit to medication. It's like, yes, we are medication experts, but we also are experts in different kind of things, any kind of recommendations over the counter, as well as certain chronic diseases. We are definitely experts in that. But studies have shown that MTM does help with downstream healthcare costs. For one article showed that MTM in a long-term care setting had reduced the cost from $22 per member per month. Now, if you just think about, if you had, I'm quite sure everyone has every health plan has over 1,000 members. Just say 1,000. That's already $22,000 per month that you're saving. So that's very essential. As well as another study showed that with Medicare Part D MTM, there's a great return of investment, in which there's $1.67 per $1 spent when considering pharmacy expenditures. So then our third key things that pharmacists do is behavior and education counseling. I know in some states you may have not seen your pharmacist counsel you on medications, but most states are now getting to the point where a pharmacist at least has to counsel on the new medication you receive. But I know for me, when I was practicing in the state of Wisconsin, I had to counsel on every single prescription. And you will be amazed how many things that we catch. I know, just as simple as in your asthma inhaler. I remember a patient came in and she was like, "Oh, my inhaler is not working." And she was like, "It just doesn't work. I keep having shortness of breath." So then I checked her medication inhaler. I checked her inhaler in the box, and the medication was expired. So it's like, of course it's not gonna work. It's expired, you know. So that's just one of the things I will say, that it's just not going to happen. So I mean, and then too, I remember another patient came in, and she was shaking. And what so happened was she was using her inhaler too frequently. And that's the thing too. If you are using your inhaler especially this is your rescue inhaler, and this is your Advair, your Pro Air, your Proventil. If you are using these three inhalers more, I would say every 4 to 6 hours, 4 times, like every 4 to 6 hours, 1-2 puffs every 4 to 6 hours. I add more than that. I would say around the clock kind of thing. You might need to go to your doctor, because you might need a more long-acting inhaler. So just be mindful of the tips for that. But pharmacists, we also provide good health practices with smoking cessation, as well as weight management counseling. I remember when I was on rotations at the Veteran Affairs, I was part of the students who did smoking cessation counseling. I think that was like the funnest thing ever to me to do, because people are very funny. But studies do really show that pharmacists are able to improve abstinence rate in smoking through face-to-face and group counseling. And that was one of the key things that we did. So then, collaborative care models. I would say, in 2013, that's when states really started to authorize the collaborative drug therapy management in different settings, such as oncology, cardiovascular disease, cholesterol, and we have really started to do that. And evidence does suggest that the addition of having a pharmacist in a collaborative team-based setting can really improve the performance against quality indicators as well as national health goals. So we are very essential. So as you can see, the pharmacy practice and pharmacists continue to evolve in healthcare, as well as we are doing more than just dispensing medications. We are providing preventive healthcare services, medication therapy management, behavior and educational counseling, as well as being in a collaborative team-based care setting. So I know it's really quick, right? I didn't want to hold you guys long tonight. Really, my goal was to be 15 15-20 minutes top. So each night it will be very quick and simple, straight to the point. I do thank you guys for joining me tonight. As mentioned before, hey cousin. As mentioned before, tonight's giveaway is the LinkedIn profile review. And all you have to do is like this page. If you have liked this page before, it's okay. Just share this live stream and use the hashtag PharmD moving forward. And if you are watching the replay, all you have to do is do the same thing for it, because I will be announcing the winners or contacting you guys by 1 p.m. tomorrow Eastern time. That's 12 Central. So thank you guys for joining me, and I hope you have a great night. Oh, but wait. Oh, thank you, Denise. Thanks, hon. So if you have any questions first, before I close, any questions? Okay, I don't see anything. So I'm going to assume you don't. But again, for my LinkedIn profile review, that's all you have to do is share that. I will announce and contact you, and I'm really looking forward to reviewing your LinkedIn profiles. And I guess I did mention on my story though, if you probably wondering why should I review your LinkedIn profile or your resume review, it's my giveaways. My thing is this: I have been practicing in pharmacy for 4 years, and I am honored and privileged enough to say that I have at least practiced in 3 different settings of pharmacy, and most people don't. So I do have a lot of variety to bring you. So all you have to do is literally just share this live stream, hashtag PharmD moving forward, and I really truly want to help you guys. Especially I know that since people have been laid off during this time of COVID-19, and I really want to help you guys and share my tidbits and things I've done. So yeah, if you want me to do, if you want to win that, simply like this page, share the live stream, and use the hashtag PharmD moving forward.